Have you looked at your feet today? It might sound like an unusual question. After all, most of us only pay attention to our feet when they hurt or when it's time to buy a new pair of shoes. But what if I told you that your feet could be trying to warn you about a serious health problem long before you ever notice it anywhere else? For many adults over 60, the first signs of diabetes don't appear in the eyes or the heart. They often begin much lower, right at your feet. Small changes that seem harmless today could be your body's way of telling you that your blood sugar has been higher than it should be for months or even years. The encouraging news is that recognizing these warning signs early gives you a chance to take action before more serious complications develop. Today, I'm going to show you 9-foot signs that could point to hidden diabetes. Some are surprisingly common. Others are often overlooked, even by people who regularly check their feet. Stay with me until the end, because the last few signs are the ones many people ignore until they become serious. Why the feet matter. Before we begin, let's talk about why your feet can reveal so much about your health. Diabetes doesn't just raise your blood sugar. Over time, high blood sugar can slowly damage the tiny blood vessels and nerves throughout your body. The nerves that travel all the way down to your toes are among the longest in your body. Because they're so long, they're often the first to be affected. At the same time, reduced blood flow means your feet may not receive the oxygen and nutrients they need to stay healthy. That's why doctors often examine a patient's feet during diabetes checkups. Your feet can provide valuable clues about what's happening inside your body. I'm Dr. Richard, and on this channel, we turn trusted medical research into simple health advice you can actually use to stay healthier and more independent after 60. Now, let's look at the first warning sign. Sign number 1: tingling, burning, or pins and needles. Have you ever felt like your feet were asleep even though they weren't? Maybe you've noticed tingling in your toes while watching television. Or perhaps your feet burn at night, just as you're trying to fall asleep. Many people assume it's simply part of getting older, but it isn't something you should ignore. One of the earliest effects of high blood sugar is damage to the small nerves in your feet, a condition known as diabetic peripheral neuropathy. Research published in Diabetes Care has shown that nerve damage can begin years before diabetes is officially diagnosed in some people. These unusual sensations often start in the tips of the toes before gradually moving upward. Some people describe it as tiny electric shocks. Others say it feels like they're walking on cotton or wearing invisible socks. One of my older patients told me it felt as though ants were constantly crawling across his feet. At first, he blamed it on poor circulation. A routine blood test later revealed that his blood sugar was much higher than expected. The important thing to remember is this: occasional tingling after sitting awkwardly is usually harmless, but if it happens regularly, especially at night or in both feet, it's worth discussing with your doctor. Early testing could identify diabetes or prediabetes before more serious nerve damage develops. Sign number 2: losing feeling in your feet. Here's a question. If someone lightly touched the bottom of your foot right now, would you feel it clearly? For many people with hidden diabetes, the answer gradually becomes not always. As nerve damage progresses, sensation begins to fade. This is actually more dangerous than tingling. Why? Because pain protects you. Pain tells you when something is wrong. Without it, you may not notice a blister, a small cut, a splinter, or even a shoe that's rubbing your skin all day. Research from the American Diabetes Association shows that loss of protective sensation is one of the biggest risk factors for diabetic foot ulcers. Many people don't discover an injury until it becomes infected. Here's a simple habit you can develop. While putting on your socks each morning, take just a few seconds to look at your feet. Do you notice any cuts, blisters, red spots, areas that feel numb? That quick daily check could help you catch a problem early. If you ever notice persistent numbness or reduced feeling in either foot, don't assume it's simply aging. Your doctor can perform a simple foot examination that checks how well your nerves are working. Sign number 3, a cut or sore that won't heal. Think back over the past few months. Have you had a small cut or blister on your foot that seemed to take forever to heal? Healthy skin repairs itself surprisingly well, but when blood sugar stays high for long periods, healing becomes much slower. That's because high blood sugar affects circulation, weakens parts of the immune system, and makes it harder for oxygen and nutrients to reach damaged tissue. A tiny blister caused by a new pair of shoes may seem insignificant, but if it doesn't heal properly, bacteria can enter through the broken skin. What started as something minor can gradually become a serious infection. According to the Centers for Disease Control and Prevention, many diabetes-related foot complications begin with wounds that seemed harmless at first. This is why doctors recommend never ignoring an open sore on your foot, especially if it hasn't improved after several days. One woman in her 70s thought she simply had a stubborn blister from walking. She covered it with a bandage and hoped it would heal. Weeks later, it had become infected, and she required specialist treatment to prevent further complications. The good news is that many of these problems can be prevented simply by identifying diabetes early and treating wounds promptly. If you notice any sore, blister, or cut on your foot that isn't healing as expected, don't wait. Arrange an appointment with your healthcare provider as soon as possible. We've covered 3 of the earliest warning signs, but the next signs involve changes that many people see every day without realizing they could be linked to hidden diabetes. We've already covered 6 warning signs that may suggest hidden diabetes. If you've noticed one or more of them, don't panic. Many conditions can cause similar symptoms, but if several of these signs appear together, it's worth having a conversation with your healthcare provider. The earlier diabetes is found, the sooner it can be managed, and the better your chances of preventing long-term complications. Now let's look at the final 3 warning signs. Sign number 7, dry, cracked, or unusual skin. Let's talk about your skin. Have your feet become much drier than they used to be? Maybe you've noticed rough heels that crack easily, or skin that seems thin, shiny, or unusually fragile. Many people assume it's simply because they're getting older. While aging does make skin drier, diabetes can make the problem much worse. High blood sugar may damage the nerves that control your sweat glands. As a result, your feet produce less natural moisture, leaving the skin dry and more likely to crack. Those cracks may seem harmless, but every small opening in the skin gives bacteria and fungi an opportunity to enter. Research from the American Diabetes Association shows that protecting the skin is one of the simplest ways to reduce the risk of foot ulcers and infections. I remember speaking with a woman named Linda who was 74. Every winter, the cracks on her heels became deeper and more painful. She assumed she simply needed a better moisturizer. When routine blood tests later revealed type 2 diabetes, she realized her dry skin had been one of several early warning signs her body had been giving her. Here's a simple habit. After washing your feet, dry them gently, especially between the toes. Apply a fragrance-free moisturizer to the tops and bottoms of your feet to help prevent cracking. But avoid putting lotion between the toes, where excess moisture can encourage fungal infections. Small daily habits really do matter. Sign number 8, thick, yellow, or damaged toenails. Now let's look at your toenails. Healthy nails usually grow slowly but steadily. They should be relatively smooth and free from major color changes. If your toenails have become unusually thick, yellow, brittle, or difficult to trim, don't assume it's only old age. People with diabetes are more likely to develop fungal nail infections because elevated blood sugar can make it easier for fungi to grow while reducing the body's ability to fight infection. Thick nails may also create pressure inside your shoes. That pressure can irritate the skin underneath and increase the risk of sores. Another warning sign is a nail that repeatedly becomes ingrown or infected. Because diabetes can reduce sensation, these problems may become more advanced before they're noticed. And here's something many people don't realize. A new dark streak under a toenail should never be ignored. While it's often caused by a minor injury, it can occasionally be a sign of a more serious condition, including melanoma. If a dark streak appears without a clear injury or continues to grow, it's important to have it examined by a healthcare professional. Healthy toenails aren't just cosmetic, they're another window into your overall health. Sign number 9, foot infections that keep coming back. The final warning sign is one that doctors take very seriously: repeated infections. Maybe you've had athlete's foot that never completely clears up. Perhaps a small cut keeps getting infected. Or maybe redness around your toes returns again and again despite treatment. High blood sugar can weaken parts of the immune system, making it harder for your body to fight bacteria and fungi. At the same time, poor circulation slows healing. This combination creates the perfect environment for infections to develop and to return. Watch for warning signs such as redness that's spreading, swelling that continues to worsen, warmth around a wound, pus or drainage, fever, or feeling generally unwell. If you notice any of these symptoms, don't try to treat them yourself for days or weeks. Seek medical care promptly. Early treatment can often prevent much more serious complications. How to protect your feet every day. The good news is that many diabetes-related foot problems are preventable. Here are a few simple habits that can make a real difference. Check your feet every day. It takes less than a minute. Look for cuts, blisters, redness, swelling, or anything unusual. If it's difficult to see the bottoms of your feet, use a mirror or ask a family member to help. Wear shoes that fit properly. Shoes that are too tight or too loose can create pressure points and blisters. Even a small area of rubbing can become a serious problem if sensation is reduced. Never walk barefoot. Whether you're indoors or outdoors, wearing protective footwear helps reduce the risk of stepping on something sharp without realizing it. Keep your blood sugar under control. Research consistently shows that maintaining healthy blood sugar levels is one of the most effective ways to reduce the risk of nerve damage, poor circulation, and foot complications. If you haven't had your blood sugar checked recently, especially if you've noticed several of today's warning signs, talk with your healthcare provider. A simple blood test can provide valuable answers. Let's review. Today, we talked about 9 warning signs your feet may be giving you: tingling or burning sensations, loss of feeling, cuts or sores that heal slowly, changes in skin color, feet that stay unusually cold, or one area that's unusually warm, changes in the shape of your foot, dry, cracked, or fragile skin, thick or unusual toenails, repeated foot infections. Remember, having one of these signs doesn't automatically mean you have diabetes, but if you've noticed several of them together, it's worth arranging a medical checkup. Finding diabetes early can make an enormous difference to your long-term health. Your feet have carried you through decades of life. They've taken you to work, walked beside family and friends, chased children and grandchildren, supported you through life's biggest moments. The least we can do is spend a few minutes looking after them each day. Sometimes the smallest changes tell the biggest stories. By paying attention to your feet, you may discover a health problem while there's still plenty of time to do something about it. That's not something to fear. It's an opportunity to take control of your health. I'd love to hear from you. Have you ever experienced any of the warning signs we discussed today? Share your experience in the comments below. Your story may encourage someone else to seek medical advice sooner. And if you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on notifications. Here on Dr. Richard, we're committed to helping you stay healthier, stronger, and more independent with simple, research-based health advice you can trust. Thank you for watching, take good care of yourself, and I'll see you in the next video. Medical disclaimer. This video is intended for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. If you notice any of the warning signs discussed today, or if you have concerns about your blood sugar or foot health, please consult your doctor or another qualified healthcare professional promptly. Early evaluation and treatment can help prevent serious complications.